presenting a case of secondary infertility with persistent intracavitary free fluid. This patient was scheduled for frozen embryo transfer but deferred due to the presence of free fluid inside the uterine cavity. And on scan, it was assessed to be Caesarean scar defect with isthmoscele. So you can see here when we did a hysteroscopy that there is chocolate material draining from the cervical os. So this is the chocolate material that is collected at the isthmoscele. Now this is what was collecting during the monitoring of frozen embryo transfer cycles. So after clearing the chocolate material, you can see that there is a isthmoscele cavity at the site where there was a Caesarean scar when previously done. Now this is the area which will have a cephalad and a caudal ridge, which is a fibrosed area, and the base of this isthmoscele will have an epithelialized portion which usually causes this kind of bleeding. It can cause abnormal uterine bleeding as well as fluid in the endometrial cavity affecting the frozen embryo transfer. You can also see that the cavity above the isthmoscele was normal. So now we proceed with the resectoscopic resection of this cephalad and the caudal ridges with the cauterization of the base. A loop electrode is used for this. A cautery setting of around 70 power watts has been used in this case. So millimeter by millimeter it is done so that you don't enter into the urinary bladder. Now the way you choose this case is, that is the hysteroscopic resection, is that the residual myometrial thickness at the level of the isthmoscele has to be at least 3 millimeters. Anything less than 3 millimeters, laparoscopic repair or vaginal repair is suggested. And also the hysteroscopic repairs have been very effective in abnormal uterine bleeding, but there have not been enough studies for secondary infertility with this kind of abnormal uterine bleeding. However, we have had 2 pregnancies with hysteroscopic repair of the isthmoscele, and their delivery is awaited. Now, millimeter by millimeter resect the portion of the isthmoscele which is causing this abnormal uterine bleeding, and taking all the care to see that the bladder is not inadvertently entered. Now at the end of the procedure, you can see that's the normal endometrial cavity, and this is the isthmoscele area which has been completely cleared of the ridges, the fibrotic area, and the base which was formed by the epithelialized tissue. Now this will be followed up with HRT for a cycle or 2 so that the epithelium covers over this area yet again. Thank you.